My name is Andrew Hewitt, and I am a psychiatric nurse practitioner. I think this is because of the great strides that have been done to help reduce the stigma of men's mental health issues. One thing that's been done is you see big celebrities such as one of my personal heroes, The Rock, Dwayne Johnson, openly discuss his battles with self-esteem issues and depression. He's talked about it in many interviews over the last few years, but more importantly, it's one of the focal points of his TV show that is loosely based on his life, Young Rock, where I feel like that definitely helps. Another way is in pop culture is the Marvel MCU movies. They are the biggest films in the last 12 years, 23 films. And all so far, and more coming. And each of the characters, in particular the main three, all struggle with mental illness of some sort, and it gets dealt with as well in their story arc. I think that helps tremendously for people. Well, this one kind of has an all-encompassing answer, and that's stress. But stress and pressure and multitasking are just different words for anxiety. We all struggle with anxiety, and we have a lot on our plates. You know, we are in a fast-paced society. People are pulling us in every direction. We have a lot of obligations to ourselves and to our families and to our jobs. And anything can cause it. You know, just a pressing deadline, traffic, the weather. I mean, we're here in Florida, and at any point in time, it could rain during rush hour, making your 20-minute drive to work 45 minutes to an hour, and that causes anxiety, and which also gets labeled as stress. These are things that can easily be dealt with therapy and medication management, as long as someone is willing to take those steps. For men, the most common diagnoses, which actually happen to be coping mechanisms, which would be antisocial behavior and substance abuse. They are coping mechanisms which actually work against us, and they hide what's actually going on. They're coping skills that will lead to anxiety and depression. And this is where therapy and medication management can come in, because therapy will teach you new coping mechanisms, and medication management will just help as you help you in that journey of learning those skills. As men, we tend to isolate quite a bit, more so when we're stressed. We don't really express ourselves too well. Growing up, most of the men in my life, they had two emotions. It was either silence or anger. Dad was happy, he was quiet. How'd you know? Because he was quiet. He wasn't yelling. Was he sad? We don't know. Was he angry? Yeah, you knew. Did his team win today? We don't know. He's quiet. But see, and that's those are the things that have to change when it comes to men's mental health. We have to communicate in order to get better, and we have to realize that the old ways of just sitting out in the garage by ourselves or having a couple beers just aren't going to fly. They're just not going to work, and they work against us in the long run. In your opinion, should medication be considered as a last resort in mental health treatment? Not at all, not at all. Medications are meant to be used as a tool. When you go to change a flat tire, yeah, you can use that straight tire iron, but having that four-way tire iron makes changing the tire a lot easier. Medications are no different. It's just a matter of finding the right tool that's needed for the problem that the patient or client is facing. And it's important to realize that medication will work in conjunction with therapy, learning new coping skills, and lifestyle modifications as you go forward. What would you say to the men that are still on the fence about making their mental health a priority? What are you waiting for? You want to be a better father, you want to be a better partner, a better spouse, an all-around better human being, a better man. You have to address the issues that you have, and we all have them. There's no reason to wait any longer. If you had a cardiac issue, or if you had even just a kidney issue, you're going to get it dealt with as quickly as possible. So why would you put mental health on the back burner? The other issue that you could have with making it a priority, or the other reason, is that you might influence someone else to hold themselves accountable and seek help that they need. Well, in all honesty, what the number one reason is erectile dysfunction. Is it a possibility? Yes. Are there other side effects that can happen? Yes. Does it mean that you're absolutely going to get erectile dysfunction? No. About 90% of the SSRIs will cause erectile dysfunction, and of the ones that do, about 10% of the population get erectile dysfunction. The good part about erectile dysfunction is that it's easily treatable with medications, with lifestyle modifications, with some exercise. Yoga works really well with helping with it. The most important thing, though, is to realize, is the erectile dysfunction a byproduct of the medication, or is it a lifestyle modification issue, or is it a medical issue? All things that can be addressed once you start in therapy and in a medication management program. Sorry. And being truthful and open and honest with your providers. Depression is a cause of erectile dysfunction. So if you come in to see me in my office and talk to me about being depressed, I'm going to ask the question, and you have to be honest. Is your libido decreased? And the answer should be yes, because it kind of goes with it. And if you're not honest, you're going to end up telling me after you start medication that it's because of the medication. It has nothing to do with your manliness. It's not an indictment on your manhood. It's part of the disease process. If you had a cardiac arrest and your doctor was like, hey, no sex for 6 to 8 months while you rehab, you're not going to take that as an indictment on yourself or as an insult. It's part of the healing process. This is no different, okay? And it's very important to remember that open communication with your provider is the best way to get the appropriate help that you need. Not at all. Medications are meant to be a tool, and they should be used as a tool. No different than if you were using a wedge and a hammer to lift up a door frame. They are meant to be used in conjunction with therapy and lifestyle modifications. Medications should be used in moderation and started at the lowest dose possible, and then you build up. But they are definitely not a last resort. They're also not meant for to be used sporadically. It's you speak to your practitioner, you come up with a treatment plan, and you follow that treatment plan and take the medication as directed and instructed, and not sporadically or however you might see fit. This is a good question, because it's prevalent. I'd have to say, like, what are you actually waiting for? Don't you want to be a better father, a better husband, a better partner, a better man, a better human being, right? If you had a heart condition, or if you had high blood pressure, would you put off getting treatment for that and risking a stroke, or reducing the quality of your life, short term and long term? And no, I mean, if it's just the fact that there's a stigma about mental health issues, we're at a point in time where we have to get over that. Our mental health is just as important as our physical health, and they go hand in hand. We have to start setting the example for those around us, and in order for us to move forward.